Hello, doctor. Previously reprimanded by the Medical Board of California is in trouble again. We do appreciate you being with us this Wednesday evening. I am Jolla.
And I'm Kimberly Hunt. Well, last year, Team 10 investigator Austin Grabish reported on Dr. Robert Shumway, who has a cosmetic surgery center in La Jolla. The medical board said he failed to have proper equipment for a patient who needed critical care.
Tonight, Austin follows through with the latest accusations against the doctor.
Dr. Robert Shumway is in hot water with California's medical board. The state agency started investigating Shumway after 2 patients had complications from work done at his cosmetic surgery center in La Jolla. Patient A had breast implants that were hanging loosely. The woman went back to Shumway to get a breast lift that took nearly 7 hours, according to the medical board. Typically, this procedure takes 2 to 3 hours, according to the Mayo Clinic. In its accusation, the board says the MD used inadequate surgical incisions and failed to use proper external pressure, such as a compression garment, after surgery. The medical board says a second woman had complications after getting a Brazilian butt lift and a tummy tuck. The board says Shumway gave false information to its investigator last year. In its accusation, the board alleges the doctor provided answers that were, quote, evasive, lacked credibility, lacked transparency, and were contradicted by relevant medical records. This isn't the first time Shumway's been in trouble with the board. Last year, I reported the board reprimanded Shumway for failing to have resuscitation equipment for a patient who needed critical care. The woman had hired the doctor to do a laser facial to improve her skin. She left Shumway's office intubated and had to be rushed to the ER.
He has to be prepared for a cardiac or respiratory bad reaction, which means he has to have the standard equipment for dealing with those problems.
Dr. Shumway's run-ins with the medical board go back to 2018. That year, he got in trouble for misleading advertising, claiming he had 6 board certifications. At the time, he listed himself as a diplomat of the American Board of Cosmetic Surgery. Dr. Shumway's website has since been changed. Now it says he has just 2 board certifications. But the Medical Board of California tells Team 10 it only recognizes one of them, the American Board of Facial, Plastic, and Reconstructive Surgery. I turned to Dr. Katerina Gallus to get help understanding the differences in credentials. She's a member of the American Society of Plastic Surgeons. To be in that group, doctors are required to be board certified by the American Board of Plastic Surgery. They must have at least 6 years of surgical training, unlike the American Board of Cosmetic Surgery, which requires just 1. Gallus says patients should consider where a physician went to school, what their reviews are like, and ask to see before and after photos of cosmetic surgeries when looking for a surgeon. She says many groups that aren't recognized by medical boards confuse patients. She uses the American Board of Cosmetic Surgery as an example. That's one of the organizations Shumway is listed as a member of. The group is not nationally recognized by the American Board of Medical Specialties. And the Medical Board of California says the differences in training are so pronounced, members of the Board of Cosmetic Surgery cannot advertise themselves as board certified.
I think it's confusing for consumers because any physician who's licensed in the state of California can claim to be a cosmetic surgeon and provide services.
Dr. Gallus explains a common background of doctors who list with the Cosmetic Surgery Board.
And generally, it's somebody who's done training in pediatrics or internal medicine or emergency medicine, and then taken some, week-long courses or weekend courses to learn liposuction or breast surgery or what have you.
We're talking weekend courses?
We're talking weekend courses, yes. There's no true regulation of what that training looks like.
So you could be an MD, take a couple courses on the weekend, and then be in the OR operating on patients who want a plastic surgery?
Yes.
Gallus has this advice for consumers looking for a board-certified plastic surgeon.
One quick way of vetting your surgeon is to find out where they're credentialed and what hospital privileges they have. Because in order to have hospital privileges, you need to be credentialed by that hospital, and the first thing they're going to look at is your board certification.
As for Shumway, his practice remains open in La Jolla. He did not return multiple requests for comment. Austin Grabish, Team 10.
Austin covers the California Medical Board and military investigations. He's also a government watchdog. Scan the QR code on your screen or email austin.grabish@10news.com to send him your stories.